Hello, if you're watching this video, you must be a person or their loved one with hidradenitis suppurativa, and your doctor has recommended surgery as part of your treatment. As you know, HS is a painful, chronic, progressive, inflammatory condition with bumps, pustules, abscesses, ulcers, and scars. The goal of treatment is to offer patients early, effective, and long-term control using an integrated management plan, including medical, anti-inflammatory treatments, pills, and in some cases injections, as well as surgical modalities. This video will focus on the surgical approach to HS, specifically explaining the deroofing procedure. For those who are less familiar with hidradenitis suppurativa, HS is recognized with typical lesions, including deep-seated nodules, sinus tracts, which may be inflamed or non-inflamed, abscesses, and scarring. The typical locations are the armpits, groin, under the breasts, buttocks, and even the perianal area. It is defined as chronic with numerous relapses. There is a 4-to-1 predominance in females over males, but we certainly have many men suffering from this condition.
HS is short for hidradenitis suppurativa. HS is a chronic condition, and it's characterized by a lot of inflammation that happens under the skin. We don't know why it happens, but at some point we know that the hair follicle gets blocked, and then underneath it forms inflammation in the sweat glands that are attached to the hair follicle. That's how you get those big nodules and lumps underneath your skin. That inflammation that sits deep in the skin has a positive effect in that it continues to make more and more inflammation and scarring, and over time it tries to find its way out to the surface, creating sinus tracts or little tunnels up to the top of the skin. And that's what you're seeing when you see lots of scarring in those areas, in the underarms, under the breasts, or in the groin area.
What HS is not, is it is not caused by smoking or obesity, but these can make it worse. It's not a type of severe acne. It's not contagious. It's not caused by poor hygiene. It's not rare at all. And it is not a skin infection, although there are bacteria contaminating the wounds of HS. The goal of treatment is the prevention of progression. At our initial visit, I like to acknowledge that this condition is difficult to bear. It can be very painful, smelly, and can make intimacy between partners very difficult. Few people, outside of friends and relatives, understand the impact this disease has on our patients. I also acknowledge that patients are often frustrated and have met with limited benefit from doctors and the medicines they've offered to date. It's common to be reclusive or even depressed. With medical and surgical management, I like to offer hope and establish a relationship that they've finally found a place where they can feel safe, understood, and cared for.
If you are quite anxious, it may be a good idea to see the surgeon first, just to get a consultation. So in that consultation, the surgeon will tell you whether or not they think this lesion is appropriate for deroofing and how much skin is likely going to be taken and how long the scar healing will take. So each lesion is different and each individual is different. So sometimes what appears to be the area involved can sometimes be smaller or larger, but the surgeon can give you at least an idea of how much skin needs to be taken. And from how wide it is, they can tell you how many weeks. Typically, I tell patients anywhere between 4 to 6 weeks, or if it's quite a large area, then usually 6 to 8 weeks. Step by step in terms of what to expect for your HS deroofing that day. So you'll arrive and the area will be cleaned and we'll inject the freezing into that area, which is the worst part. but afterwards you really don't feel anything. The surgeon might wait a few minutes just to let the freezing diffuse out and make sure it's really done its job. And then essentially the skin will be taken off in that area, and then the area will be buffed and the wound dressing will be applied already that day. So I can definitely put your anxiety to rest in terms of the fear. So really, the wound care is no different than the types of wound care you may have had to do for flares that you've had in the past with drainage. In terms of things that can help your anxiety, if you do have a consultation with your surgeon beforehand, they may give you an anxiety medication that you can take about half an hour before your procedure, and that can definitely help calm you down, but you will need a driver to help drive you home afterwards. Another option is some clinics do have some anxiety medications or gas or laughing gas in their clinic that you can use during the procedure, which again helps with a lot of the anxiety. So what HS deroofings try to do is it follows those sinus tracts or those tunnels down to the lower layer of the skin, and the skin above it is removed, and the inflammation that sits deep in that skin is buffed out. And it's left open to heal. And by leaving it open to heal, we know that there's no inflammation left in the skin to perpetuate that cycle again. So here are a few frequently asked questions about HS deroofings. Number 1, is it under anesthesia? So no, it's actually done just right in the clinic with your dermatologist or your surgeon, and essentially injected freezing is put there into where those lesions are. Then after a few minutes to let the freezing set in, the scarring is followed all the way down, and then, as I mentioned, that process takes place.
Can I do multiple deroofings on the same day? Yes, but usually only one spot will be done on your first visit. That helps you get used to taking care of an open wound, so future procedures are less intimidating. Many patients can have 5 or more deroofings over the course of their care. Which lesions are best suited for deroofing? Well, usually deroofing is best suited for persistent, stubborn abscesses that have even been injected with a steroid, but still recur.
The wound healing that is involved is quite simple, actually. So all you need is either Vaseline or Aquaphor or an antibiotic ointment that your surgeon will prescribe, and you essentially apply it over that wound area once a day. And you apply a dressing over top, and that's it. Depending on the site that's involved, sometimes the dressing choice can be a little trickier. So if it is the underarms, that tends to heal quite nicely without much functional impairment. And really, you can purchase a larger dressing bandage that has some adhesive on the side, and that's about it. That's about all you need. If it is in the groin area where these folds can tend to rub up more easily, sometimes even using a sanitary napkin can be helpful, or again, using one of those gauze and medical tape, or using dressings may be helpful.
How big will the wound be? It's difficult to predict, but can range anywhere from 1 centimeter to even 7 centimeters long.
One common question is, do I need to take time off work? So you don't necessarily need to take time off work, but you may feel more comfortable depending on the area if you have a few days just to adjust. So many patients, if it's in the underarms, they're not too worried and they can go back to their work and most of their activities. Some patients that have it done in the groin area are a bit more apprehensive and they may take a day or two off just so that they can adjust to the wound care. It's good to know that the area is not that tender afterwards, and really only Tylenol is typically needed in an area after deroofing. The freezing wears off after a few hours.
Can I exercise afterwards? Vigorous exercises or going to the pool afterwards should be avoided, but depending on your level of comfort, light exercise is usually tolerable after the first week. I hope the information you've heard today has helped inform you and reassure you that the deroofing procedure is a safe and effective treatment for hidradenitis suppurativa. Thank you for your attention.